everyone, and welcome. Today, we're going to break down the fundamentals of cancer therapy. We're going to cut through all the complex jargon and really get to the core strategies that doctors use to fight this disease. All right, let's dive in.
And hey, quick heads up before we jump in, if you find this explainer helpful, do me a favor and hit that like button, subscribe to Smart Tutor, and you can even find us on TikTok. It's a huge help and lets us keep making more content just like this. So here's our game plan for today. First up, we're going to tackle the big question: what even is cancer? Then we'll look at the 3 different goals of treatment. After that, we'll open up the treatment toolbox to see what's inside, talk about 2 major strategies, and finally, see how it all comes together in a real plan.
Okay, so before we can even talk about the treatment, we've got to understand the problem itself, right? What exactly are we up against?
At its most basic level, cancer is really about the body losing control. Think of it this way. Your body has these super strict rules for how cells should behave. When they live, when they die, how they multiply, that's proliferation, and when they get their specific job assignments, like becoming a skin cell or a liver cell. Well, cancer is what happens when those rules get broken, and you end up with cells just growing and multiplying, totally out of control.
All right, so we know what cancer is. The next logical question is, what are we actually trying to do about it? Because, the goal isn't always the same for every single person. There are really 3 main objectives. Okay, so goal number 1, the absolute best case scenario is always a cure. This means completely getting rid of the cancer and getting the person's life expectancy right back to normal. But if a cure just isn't realistic, the goal shifts. We move to prolonging survival. The focus here is on extending life, for sure, but also on making sure that life has the best quality possible. And finally, there's palliative care. Here, the goal is all about providing comfort, relieving symptoms like pain when we know a cure is unlikely. And this is so important. What counts as a win really depends on the individual and their specific situation. So, how do doctors actually try to hit these goals? Well, they've got this incredible, diverse toolbox of treatments, or what they call modalities, at their disposal.
Now, you've probably heard of the big 3, right? Surgery, radiation therapy, and chemotherapy. But the modern toolbox is so much bigger than that. It also includes things like hormonal therapy, which is really effective for certain types of cancers, and then there's the really cutting-edge stuff, biologic therapy. This is where we get amazing treatments like immunotherapy that basically unleash your body's own immune system to fight the cancer. So cool.
Let's zoom in on chemotherapy for a second. These are really powerful drugs that are designed to kill or at least slow down the growth of cancer cells pretty much anywhere in the body. And the way chemotherapy works, well, that brings up a really, really important strategic idea that we need to talk about next. Okay, this next part is maybe the single most important concept for understanding cancer therapy. It's not just what tool you use, it's all about how and where you use it. This is the idea of local versus systemic strategy. And this slide just lays it out perfectly. Think of local treatments like surgery or radiation as being super precise. It's like finding one single weed in your garden and pulling it out by the root. You're targeting a very specific spot. But systemic treatments like chemo or biologic therapy, they're like treating the entire garden's soil. They travel through your bloodstream to affect your whole body, which is absolutely critical if the cancer has started to spread or what doctors call metastasized. Okay, so we've got our toolbox, and we've got our 2 main strategies, local and systemic. But here's where modern medicine gets really, really smart. The true power isn't in picking just one. This is the real game changer. These approaches are almost never used alone. The best plans often combine them. So for example, a patient might have surgery. That's the local attack, right? To get the main tumor out, but then they'll follow it up with chemotherapy, the systemic attack, to hunt down and destroy any sneaky cancer cells that might be hiding anywhere else in the body. It's this 1-2 punch, this multi-pronged attack that makes modern therapy so incredibly effective. And all of this leaves us with one final, kind of mind-blowing question. When you think about everything involved, the type of tumor, where it is, how healthy the patient is, their genetics, all of it, how on earth do doctors take all these pieces and design a completely unique, personalized battle plan for every single person? That right there, that's the heart of modern oncology. It's both a science and an art. Thanks so much for watching.